For President Obama. The United States Supreme Court today upheld a key provision of the Affordable Care Act known as Obamacare. The decision means roughly 6.4 million Americans will continue receiving financial assistance from the federal government to help them purchase health insurance. Joining us now is Indiana Congressman Luke Messer. He's a Republican, very vocal critic of Obamacare. I know you must be deeply disappointed, Congressman. Were you surprised that it was a 6-3 decision, including the Chief Justice, John Roberts, Anthony Kennedy, who was named by Ronald Reagan, that these two Republican-nominated justices decided to vote in favor of continuing Obamacare?
Yeah, sure, I was surprised. I think it's a disappointing day for the American people. You know, the decision today doesn't change the fact that the health care law is broken. It doesn't change the fact that the health care law is unpopular. And while there's certainly been some winners under this law, tens of millions of Americans have seen their premiums go up. They have deductibles they can't afford. And so now we have to be focused on what do we do for all those people that have been harmed by this president's health care law.
Well, the president points out that a lot of people have benefited by it. For example, parents now can keep their children on their own health insurance policies until they reach the age of 26. Do you support that?
Yeah, I do. I mean, I support the fact that parents be allowed to keep their kids on the law. And there certainly have been some winners, but there have been a lot of losers, too. Wolf, I talk to them every day back in my district. And what we have to do now, that the Supreme Court decision has come, we have to focus on what we can do to help those hurt by the law.
What about the law allowing people to get health insurance and no longer having to worry about pre-existing conditions? As you know, in the old days, if you had a pre-existing condition, the health insurance companies wouldn't necessarily sell you that health insurance. Is that new provision in Obamacare something you support?
Yeah, I do support that. But I don't support taxing young, healthy people to pay for folks that otherwise, fall within this law. I don't support the 30-hour full-time work week mandate under the law that has decimated the 40-hour work week in America. Again, there have been winners under the law. There's some good provisions in this law. There have been a lot of people hurt, too.
For all practical purposes, you have a decisive Republican majority in the House, a majority in the Senate. You can continue passing legislation to revise or change or get rid of Obamacare, but the president's going to veto that legislation. You don't have a two-thirds majority to override a presidential veto. So what's next in your effort to kill Obamacare?
Yeah. I think we have to keep our promises. We're going to continue to stand up to this president's law, including potentially reconciliation that would try to repeal it. I've mentioned to you some of the areas of the law that we ought to try to fix. And I think what comes next for Republicans here in Congress is we're going to have to do the hard work of coming forward with our own plan. There's several different Republican plans out there. I think you'll see plans rooted in tax credits, trying to deal with competition across state party lines or state boundaries. And I think you'll also see us look at medical malpractice reform and health care savings accounts. But we have a responsibility now. If we're going to complain about this law, we've got to show the American people what we would do if this law was no longer the law of the land.
All right, Luke Messer is the Republican congressman from Indiana. Congressman, thanks very much for joining us.
I'm glad to be here, Wolf. Thanks.
All right, Luke Messer joining us. Coming up, the Florida Democrat, the chair of the Democratic National Committee, Debbie Wasserman Schultz. She obviously